Health Education Lecture Series. I am your host, Gurdeep Singh Sandhu, homeopathic consultant. My clinic address is 9701 Sarah and Court, Dublin, California 94568. And the phone number is 408 687 1899. Anytime when you are suffering from any disease at any age and you are stuck up with the treatment, you do not feel any progress, please call me for your second opinion of the disease and also of the treatments. And if ever you want to get homeopathic treatment for your disease, because homeopathic is the scientific approach to your health. Why I say scientific approach? Why I say scientific approach? Because it has direct relation to your vitality, it has direct relation to your body. Just like what the body needs, it expresses itself in symptoms, in feelings, desire, and aversions. And mostly, what happens nowadays in the medical science, we avoid all these things. I will start with the simple example and will go further. How we ignore the demand of the body, demand of our vital force, demand of our living force inside the body. When that force is not inside the body, then we are not surviving. We are dead. But that surviving force is inside the body, and we are surviving. In this way, in this way, the homeopathic is a scientific approach to your health, to your body, because it follows the instructions of the body. And as I said, under all disease conditions, the body sends signals and symptoms what she needs, what the vital force needs, what she is lacking and need help for that. Suppose if someone is having vomiting or diarrhea, just imagine why there is a vomiting, why there is a diarrhea, because something has gone inside the body which is unwanted, which is not acceptable by the body, or is over and above the demand, just like you take more chapatis, more heavy foods and all that, and body wants to expel it out. It's a beyond the limit of the demand, and it tries to expel it out. If it is nearby, it tries to expel it out from the body by vomiting. Vomiting is the indication that something has gone inside the body, and it is not that long time, it's a short time. It's a short time that it has not gone into the long way in the intestines, and no, it can come out, and body tries to bring it up. As I told you, when the food reaches into the intestines, from mouth to the intestines, there is a big long way. There are many more hurdles in the way of the food that this food has passed. And when it has to come back, definitely those hurdles it has to pass again to come up back. But that's very difficult. Just like I told you, from the intestine to stomach, there is a one hurdle, there is a one door, there is a one constriction that is known as pyloric opening. When the food from the stomach goes inside the intestines, that opening is closed. But now the food has gone into intestine, but this is unwanted. Even it may be unwanted when it is a stomach, when it is inside the stomach, and at the same time you feel like vomiting. Ultimately it will come up easily, and even the food material will come up easily. But suppose it has gone up to the intestines, and ultimately it will take more force, it will take more power to expel it out through the vomiting, through the back doors. In this way, what will happen? There will be retching. A retching is a powerful nauseatic tendency which may or may not result anything. But ultimately, continued retching, continued nauseatic tendency will bring up vomiting. Means with the backward force which the body is using, ultimately the food stuff from the intestines, that's not basically the food stuff of the same nature which has gone inside. No, it's a different kind of food, because many of the gastric juices has been mixed into that, and the gallbladder bile has been mixed into that, the pancreatic juice has been mixed into that. Ultimately that comes back, and the pyloric opening is opened and it goes to the stomach. You feel heaviness, and ultimately stomach push it out backward, and the cardiac opening is open, and then the diaphragmatic open is open, and then the epiglottic opening is opened, and then it comes out. You can now well imagine how difficult it is to bring up the vomiting. But if nature wants to bring up the vomiting, so in this way, ultimately everything will come up outward, if it is possible, if it is under the range of this body to bring it up. But if you stop this process of the nature, if you do not help this process of the nature, you try something in the shape of medicines to stop this one, what will happen? The outward, or the reverse process of the body, which the body was taking naturally, will stop. That peristaltic, reverse peristaltic motion will stop, and this food stuff will remain over there and will be forced down, because the nature has no other way out. If it is not coming out from the mouth, it has to come up to the normal way, up to the rectum. With the stool, it should be evacuated. And under this condition, it is not that simple as I explained you. Then okay, if you stop the vomiting, it will go to the diarrhea or stool. It's not that simple, because you have stopped the natural process of vomiting forcibly by the medications, and you will have to suffer for this one. One power is pushing it outwardly from the mouth, the other power is pushing it backward forcibly to downward, and you have to suffer uneasiness, sinking, anxiety. All these things will you will feel if you are having this kind of symptoms. And ultimately, if it comes out, why a people feels relief when they have vomiting? Because whatever the nature wants to do, that one, that has been done, that has come out, and ultimately you feel relief. But with the tendency of stopping the vomiting forcibly is not in favor of the vitality. And ultimately, that toxic substances which nature wants to expel it out backward from the mouth will go down to the intestines. And ultimately, some of the toxins will be absorbed by the intestines, mesentery, will go to the blood as well. As other food materials are squeezed from the intestines and going back to the to be mixed into the blood and the new blood formations, the same way that toxic substances will go there, and ultimately, in a long term, it will produce very bad effects on your body. Second simple thing. Second simple thing, that this process will go at its normal course, because you have blocked the upward way. which was not the natural way, but nature wants it, and nature was capable of doing it by one or two or three processes, means retchings, nauseas. Ultimately, it vomits. So you have stopped that process, and ultimately it goes to the, some of it is squeezed and go to the blood. If it is a toxic, it will be very dangerous for you. Ultimately it will produce many other bad effects inside your body. And on contrary, on the other hand, the normal process will go up in the shape of diarrhea, not the normal stools, because the nature wants to expel this stuff out as soon as possible, and it will increase the peristaltic motion. And as long as your anti-peristaltic motion medications, antispasm medications, which has been given to stop the vomiting, will remain in effect, at that time you will feel anxiety. At that time you will feel uneasiness. And when that stuff will go to the rectum and will be evacuated in the shape of diarrhea, you will feel little relief. But as I told you, some of it, if it's toxic, some of it will go to the blood by being squeezed from the intestines and will be mixed up into the blood as the other foodstuffs are mixed up. In this way, that will produce a long time bad effects on your health. So this is what I want to convey you. When you do not follow the instructions of the body, you have to suffer more. But if your treatment is following the instruction of the body and you help this system to do the same thing in an easy way, automatically you will feel better. Just like, I can give you another example. There is a labor pain the lady has. Okay. If you stop the labor pain by anti-spasmodic medications or something like that, because most of the doctors does it in the second stage of the labor, that's okay. In the second stage of the labor, because there is a wide opening of the mouth of the uterus, and yes, and the head is engaged outside in that one, it will not go away and it will push out. That's okay. But if you do that unknowingly, that anti-peristaltic motions or painkiller medications, even in the first stage, what will happen? It will contract the uterus, and the baby may die inside the uterus at that time. Ignorance. The same thing I'm talking about. The same thing. If that toxic substances is not being released by diarrhea, because you have already stopped the process of vomiting by the peristaltic motions of that one, you have stopped the nature's process to evacuate it backward from the mouth. Under those conditions, what will happen? It will go to the diarrhea. And as I told you, some of it will go to the blood, mixed up blood by squeezing from the intestines with other food materials. So that will produce a long time bad effect on your body. And with the diarrhea, the nature wants to clean it up by the other way out, which the nature has already, according to the system, that everything, the waste product, whatever is unwanted, go out from the body by the stool. That goes out. And by saying this thing, I want to convey this, that whatever folly is going on as a practice in the medical science at this time is to stop all the symptomatology, to stop all the indication of the nature, what the nature wants to do. And same, this was a simple example of that one. The vomiting is a simple example that you can understand that one. And what are the symptoms are produced by the vital force through the body. These are the indication what the nature wants to do. In these disease conditions, what the nature wants to do, this is then indications. And most of the medical sciences, what's going on, that whatever the symptoms a patient tells to the doctor, They give medications to stop that immediately without understanding that what the nature wants, why the nature has produced pain, because something has stuck up. The explanation of pains I have given many times in these lectures, that there are many more things, just like blood circulation, that just like the nervous current in the nervous systems, that is the lymph channels is passing through the lymph channels. All these things are moving inside the body, and whenever lymph, blood circulations, artery or veins, they are blocked somewhere by any means, it is blocked by somewhere, then they are putting pressure on the underlying nerve, and nerve send a message to the brain, and that is indicated as a pain. This is the explanation of the pain. And why this is blocking over there, why this pain is coming from my thigh, from my knee, from my hip, from my joints, or whatever, because something has stopped over there. The regular flow which is going on inside my body has stopped somewhere and producing a pressure, stagnations, accumulations at certain areas, and because of that pressure, the underlying nerve is pinched up. Nerve is feeling pain, and that telephone line of the nerve sends the message to the brain, and that is expressed as a pain. We express it in this way without understanding why this pain is, and to release those processes. The medical science nowadays doing, giving the medications so that this connection should not continue. The telephone connection should not continue in the same way, and this pain message should not go to the brain. And you should not feel pain. But there is something wrong inside the local area where you feel the pain. Under those conditions, when the time of your medication will be over, because everything which goes inside the body is of its nature, that it is made up like that one, that whatever unwanted goes inside the body, that is evacuated after certain periods. Even the waste stuff of the food, waste stuff of the water, drinking, and everything, it goes by the urine, by the stool, by the sweat. Every time nature wants to expel it out. The same way your medication, which is painkiller medications you are giving without understanding the nature of pain, without understanding the language of that pain, what the vital force wants to express you, that this is the main reason of your pain, and you are stopping that pain, means you are disconnecting the telephone connection. Just like at the time of 1984, all the connections of the Punjab was cut down from the whole world. No phone was going, no connection was from Punjab to with the whole world, even not only the country, the whole world. It was disconnected, so that no information should be sent to the other regions, so that there should be a big violence. To avoid that one, this was done. The same way, if you are giving any painkiller medication without understanding what is the reason behind that, ultimately, after the expiry of the time of that medication, expiry means it has been evacuated from the body, because it's the rule. It's the rule that whatever is unwanted, gone inside the body try to expel it out as soon as it's possible. That's why you say, after every 6 months, doctor says, oh, you have to take the painkillers, or you have to take this medications after 6 hours, after 8 hours, after 12 hours, or once in a day, or twice in a day, whatever it is. Because they know that this medicine will be expelled out from the body within this periods. The body is capable of, in a routine for general, this body is capable of evacuating all these stuffs within this hour, within this period. That's why they say, okay, you have to take this medication 8 hourly. You have to take this medication 12 hourly, or after every 4 hours, because they know that until their concentration from the body has gone, you will again start feeling pain. It's better to take that medications to avoid that pain. But just understand, even a layman can understand what I'm saying. Even a layman can understand it's not going to cure the malady. It's not going to cure the problem forever, because we are not treating that one. Yes, it happens, and sometimes when you are young, when you are healthy, when this body is responding to your pains and everything, ultimately, wherever there is a block and you feel pain, body itself try to recover that pain, to open that block, because itself, it's a self-receptive body. It cures itself. It cures himself by its own efforts, even without the medications. Nobody gives any medication to the animals or all that. You can say the parrots, mm, kabutar, and all that. Well, nobody gives the medication to these things, but they are recovering, because the same way our body is also capable of recovering himself. But when it is not capable of recovering himself under some conditions, then it cries, and those symptoms which it says are the cries that you have to remove that one. And removing those symptoms with a painkiller does is not the answer, is not the actual help the body wants to. Body wants that you should understand what is the reason behind that accumulation or stopping of circulation of any circulating substance. Circulating is the blood, circulating is the lymph, circulating is the current in the nervous system. So all these things, some of it has been blocked, and you should continue it. You should start the flow. What are the hurdles? What are the blockages? You should understand and remove those ones. If you want to get rid of this thing forever, this is the only way. But what's going on, what I'm telling you, that in medical science, the first thing is, most of the people nowadays are taking painkillers. You can go into markets, and over the counter you will get ibuprofen, paracetamol, this and that, Advils. Many other painkillers are over the counter, and people are taking it regularly. They become addicted to that one. But they do not understand that why I am taking this thing, because you need that. You need to remove the pains. You want to remove the tiredness and all that one. But why there is tiredness? Why there is accumulation and you feel pain? Under those conditions, until and unless you understand the actually reasons behind that one, you are not doing the wise thing. You are not helping this body or the vital force to recover. You are just subsiding the things, and subsiding ultimately will result in a bad way, because you have to pay for the concentration which is going inside your body of that medication. Even the painkillers, if you are taking painkiller regularly without being cured, ultimately they make an accumulation inside your body, inside your cell means. And the work of this cell is disturbed. Cell of the body, cell is a compact thing, and there is no vacant space for that one. And ultimately, when you push something extra into that one, they will they will hold some space over there, and the working of the normal organelles inside the cell will be disturbed. Normal functioning will be disturbed, that is useful for the whole body. In this way, the functions of all the other systems will be disturbed, because if mitochondria is disturbed, it means the electricity power is disturbed, and the electricity power in the whole system will be disturbed, not only one cell. So ultimately, the body will feel weakness, anxiety, all these things. The same way, every organelle, lymphos, there's a neutrophil. Yeah, sorry, I'm talking about this, the cell organelles. There are nucleus, Golgi body, mitochondria, centrosomes. All these things, they are having their different functions, and whatever function is disturbed, it will show up in the whole body, and you will see the symptoms in the whole body. And unless you take care of all those functions, and you go properly deep to the reasons behind the cell, what is going on, what is extra has gone into the cell, which is disturbing the function of the cell, you will not cure the persons. Painkillers, temporary relief, or stopping the vomiting immediately is not the actually result we need. We need that whatever has gone wrong to correct that one. In this way, the homeopathic system, I'm not commenting on any other system, because most of the system, suppose if pain is unbearable, at that time you need to give medications to immediately get the reliefs. That's okay, because every science has its own importance at a certain point of the sickness. If unbearable pain is there, yes, definitely you need something to just immediately relieve that, so that you should not have any unconsciousness with pain, any attack type of things with pain. No, you need that one. In this way, the actually relief you will get is this painkiller can give you a time to think over that why this thing was, so that you can choose the medications which can help what type of help nature wants to, what this body wants to do, and you can do that one. That is just giving the time to you to think over that what this body demands to get relief permanently from this pain. Temporarily, pain reliefs are not giving you the results which you need. In this way, though I told you all these systems are useful to the human bodies. Why? One more thing is common in all the systems. Medicine we make from the substances, and those all substances are the product of nature. And all the sciences, because we have named different things, allopathic, ayurvedic, homeopathic, these are names given by us, and these names are given because we are using the internal power of the substance according to our own different way. If we are taking the material dose of the substance power, because suppose the opium or the belladonna or the post, you can say that one, it has given some inherited power by the nature to it. That remains the same. If you use the crude form of this thing, natural product, poppy plants, or the opiums, this natural forms of this one, and it will affect physically and stop physically something what's going on, stop the functioning of the physically, slow down and everything. It's his inherited power. But even if this inherited power is used by allopathic type of things, they are using the same power. There's no difference, because the substances from where we prepare the medicines are the same for every science. Allopathic, Ayurvedic, homeopathic substances, if you make the medicine, means you are taking something else from the universe to relieve your complaints. It means those substances every science is taking from the nature, and I'm giving you an easy example of the poppy plant. And if allopathic uses this one, they use it in the shape of morphine and pethidine, same thing, but it is more concentrated. What concentrated is the active constituents. This is known as active constituents. These active constituents are the actual power which is given by nature to the poppy plant, and that is delivered when it comes into the shape of opium, and that also goes with it when it is converted into morphine and pethidine. And the same way the homeopathic system, because poppy plant may be dangerous to some bodies, and the morphine and pethidine may become more dangerous to the persons if it is given by the untrained persons, not fully qualified person who is authorized to do that, because there are different degrees of the doctors, that you are permitted to give this medicine up to this range, you are permitted to give this medicine up to this range. There are different doctors degrees so that they can give it to them. So but that becomes more dangerous. But the homeopathic science says the quality, the natural power, inherited power by the nature, that is known as active constituents of a substance, if it is used, if it has to work, if this power has to work, then why not this should be used in a smallest way, so that which should not be dangerous to the physical body. And if it expects, it has been expected, it has been verified by Dr. Samuel Hahnemann, and ultimately he resulted it. And I can give you one example for that one. There are many more other things I can say, but I can give you the easy example which you can understand. In the previous years, in 17th, 18th centuries, sulfuric acid was given for the complaints of the liver. Even still, it is given, but in a different shape. Sulfuric acid was given to relieve the complaints of the liver. But everybody knows that, yeah, this is foolishness. Doctors are saying sulfuric acid. If you put the one drop of sulfuric acid on any substance, it boils. Even to clean the rusted pipes of iron, if you put to clean those pipes, we put sulfuric acid on that one to clean those one. Means the rust is boiled. It cleans the stuff. Means it's so powerful. It burns out everything. But still, forefathers of medical science, they knows that if there is an enlargement of the liver, if there are many other problems, ultimately sulfuric acid was the good medications for that one to be given. And they also know it. They also know it, that this is very dangerous. Then until Hahnemann, but they were also using this in a different way, dilutions way. At that time, the dangerous medicines were also used in a dangerous way, in a safe way, to use their effects. And the Hahnemann ultimately resulted it out in spite of using, just I gave you the example of opium, in spite of using opium, in spite of using morphine and pethidine. If you make the dilutions of this one, just like the sulfuric acid is given, suppose if you put one drop of sulfuric acid in 1 cup of medicine, 1 cup of water, and you drink, it will not spoil your mouth inside. It will not produce any harm inside your body, because it has diluted its effect. But the active constituents, the inherent power by the nature of sulfuric acid, will remain the same. And if it works in that way, then why to give the material sulfuric acid? Then why to give the material morphine and pethidine? Then why to give opium and all that one? This is what example I'm giving you. Yes, under circumstances, I already told you, just like the allopathic peoples are doing, and that's helpful. That is, under some condition, it's helpful immediate to get the relief, immediately to stop functioning of any body, so that any part of the body is feeling pain because of the obstruction somewhere, and he do not feel that. Till that we can understand what to do for that one, actually what the body needs to do, and then that will be recovered. In this way, in this way, we should we should understand the different medical sciences, but we also should understand the source of making medicines for all the medical sciences is the same, but using their active constituents or the inherent power of the substances which they are getting it from the nature is the same. And if minimum power of the substance is used without any side effect and can give us results, then why to use the material doses? But yes, sometimes we need. It's a criteria. It's a criteria. It's the stage where we need the material dose just immediately to affect the physical body. But for most of the diseases, they are not only physical. Because, first of all, there are two ways. The diseases starts from mind and ultimately goes to the body. Diseases starts from the body, ultimately goes to the mind. I can give you the example. A person is worried about for many things continuously, is not sleeping because of the tension, because of the problems, various type of problems, and he do not have any solutions for that. When he get the solution, he is calm, but he is not having any solution in mind, and he is not capable of doing any solution at that time. He is anxiety, depression, mentally disturbed, and what will it result? Anorexia. He do not like food, he do not want to eat food, he do not want to drink water, and he cannot go to sleep, and all these natural processes to refresh the body are not recovered, are not going into the norms, and this will result in physical symptoms. The condition was mental state was feeling all these things, overburden which it was not able to resolve, and that ultimately has resulted in its physical state, and physical state is expressing no appetite, no thirst, even constipations, sleeplessness. All these things we feel because it has converted into physical. And the same way a person is having indigestion since long, or a person is having any internal problem of any organ in the abdomen or in the chest, and it's a long way has passed, and under those conditions, ultimately it will bring up mental disturbances. Here it is not recovering. I'm taking the medication, even then it's not recovering. What to do? Under those conditions, it becomes mental anxiety, depressions. Physical things goes back to mind, mental things goes back to physical. But but the resultant of it I can tell you is this body is nothing without the mind is nothing without the soul. In this way, if that soul is not inside the body, this body is known as dead. It's not working. All the organs are there. When dead body, all the organs are there, but they are not working. It means the soul is solely responsible for all the functioning, normal and abnormal, inside the body. In this way, if a person falls sick, it indicates that something has affected the soul, something affected the vital principle, vital power, which was controlling the normal function of this body, and that has been affected. And the second thing again comes up into mind. This will come in physical states, and then the physical symptoms and all that. Basically, the patient goes to the doctors with the physical symptoms, very few in the mental stages. But and the doctor has to realize that whether this has gone from mental state to physical or from physical state to mental state. Because if someone is coming to my clinic and he is coming from the home to my clinic, whatever exit he has passed, when he go back, if the same exits comes in reverse order, he can understand that I'm going back, I'm going home, the way is the right way. In the same way, when a person from the health becomes sick, and if he is now recovering from sickness, he has to pass the same way. Now, the physical state, the physical problems a person expresses in front of the doctor, and doctor starts saying this one, but it is not curable until we know that how this physical state appeared. What was the reason behind this one? Whether it has come from the mental state, long past tension, anxiety, and all that, or whether it has resulted from the any indigestion, any overwork, anything which this body has played or you have played extra, that has resulted in this condition. So in this way we have to decide at that time. And when you are treating all these things, you must understand this thing, that it has to go back. If the right direction is there, if we are following the right direction, the mental state once will go to the physical state, and then it will be cured, and the physical state will go to the mental state, and then it will be cured. This is the only way you have to. And in this way, when you are understanding the diseases, and you understand that the vital principle is the solely responsible for all the functioning of this body, then why not, in treating this physical body, go directly to the vital force to treat him? But it is not that easy to say, just like I'm saying, okay, go to the vital force. Vital force express herself or itself by the physical body and symptoms of the physical body. And you have to, second thing, this is what the vital force expresses himself through the physical body. My mouth is working, my nose is working, my eyes are seeing, my ears are hearing, all these things. Vital force is working, a power is working, which is the explanation of life, you can say. And now we know that we have to teach that vital force, because that was the responsible. Go to the grandfather. If something is done wrong by their kids, okay, in spite of dealing with these people, ultimately it will not result with anything. Again, the same thing will happen. Let's go to the grandfather, tell him that this is not going on, so that he can take a proper action about that one, and things should be corrected in this way. And to reach grandfather, it's not that easy, because he is expressing by his children, and you have to make some alternatives, some something to suffice all these symptoms, what the nature wants you, not to go against them. If you will go immediately to complain, any grandfather complained about his kids, he will also be angry, because he has been already told by his kids. But if you go politely to set aside the things, ultimately it will result. And how it is possible in the shape of your medicines? It is possible in case of disease and sickness, that you follow the symptomatology, what is expressed by the vital force, and those symptoms are known as mental symptoms. Mentally, first of all, vital force expresses herself itself through the mind. Mind expresses himself through the body, and body expresses the symptoms. And these are having categories: mental symptoms and physical symptoms. Physical symptoms from head to heel. All these things you have to collect it. And if you directly treat the mental symptoms, or your treatment is based on the mental symptoms, everything will be resolved. Grandfather has signed this thing. No, we decided this thing. Okay, all his kids will follow this thing. All the organs will follow this thing. That has, but it's not easy. Suppose if I say, uh, dissolve ammonia chloride into the air, you will say a doctor is foolish. Eh? How it is possible you can dissolve the ammonium chloride into air? But there is way, because all the substance of the universe at the end base, they are the same. They have their invisible power and they have their visible shape. This visible shape has invisible power at the back. Okay, so I'm saying that if a person, I'm just convincing you in an easy examples. I'm saying mix ammonia chloride into air. Looks foolishness, because we are, on one hand it's invisible things, on the other hand we are asking the physical things. But when you smell ammonia gas, what you smell? You smell ammonia salt. What it indicates? It indicates that the ammonia salt was mixed into the air. How it was mixed? When by any chemical reactions, by any way, this ammonia salt was converted into the shape of air, because all the physical substances have their origin from the immaterial power. Even a stone, every physical existence in the universe has its back invisible. Okay, in this way, ammonia salt was mixed into the air by a process. In this way, you have to treat the vitality, you have to treat the vital force, the grandfather, not the organs, different individual organs. The folly is that nowadays we are treating the individual organs. We have a special doctor for the heart, we have a special doctor of the kidney, we have a special doctor of the liver, this and that. For all the organs, we have specialization. But if we understand, if we believe that one, these all organs are controlled by the vital force, and you are capable of reaching to the vital force and making him convinced about the facts, definitely, or you are capable of giving help to that grandparents, that okay, you do this and this and I can help you in this way, so that whatever your sons or your grandsons are doing wrong, they can correct it. Automatically it will be. And it's not that saying only, it's not only philosophy. It has been verified by the homeopathic system of treatments. People do not believe, yeah, what this tiny tablets will do, or what this one drop of medication will do to my body. I have a large liver, I have a big tumor, I have this and that. How it will affect that one? It will. It will, because because our ultimate source is invisible. That is the vital force which was responsible for all the enlargement of the liver, for all the problems in the heart, for all the problems in the kidney, the physical state. And they are controlled by the vital force. And the vital force is expressing himself, number one, mental symptoms. Number two, physical symptoms. And physical symptoms from head to heel. In spite of taking physical symptoms from head to heel, if you are capable of taking the mental symptoms, what the problems of the grandfather, what the grandfather wants to do, how the grandfather want to resolve this thing, and if you resolve this thing with the shape, with the medicines, then ultimately everything will be resolved. And now the question arises, just like I gave you the example that ammonia salt, how you can mix that ammonia salt in the air. It has been mixed. We see that it's a chemical reactions and we make the gas, and that's ammonia gas. In this way, ultimately, we have a process designed by homeopathic system of treatment that if you bring up the inert substances, inert power of every substance. Inert power of every substance means the inherent power of every substance. Why we say alumina, mercury? Why we say borax, suhaga, salt, and sugar? All these are whites. If you make them powder, all these are whites. But they are having individual inherited power by the nature. That we have to explore that. And that is why, at a physical level, we know their power. That is why we do not use sohaga or farkadi in spite of sugar. And sugar will not work where sohaga and farkadi needs to be used. But they are having individual characteristic power inherited by the nature. That's why their name is different. And all these powers are recognized. How we recognize that? How a substance affect our human body. If we take a sugar, how it affects our body, how we feel, how it affects in the body. If we take borax, how it affects, how we feel. So every substance has its different quality of affecting the human body. And how a substance affects the human body, that is the inherent power of any substance. And on that basis, every substance has been given a different name. Second point, we have to go find out the close inner power of every substance. That is known as trituration in homeopathy. How we make the medication. I will describe in my next lecture how we make the medications. And we make the trituration. Even in Unani system of treatments, they were making ashes of the substances because they know the inert power of the substance, the inner quality or the inherited power by the nature of any substance. It may be copper, it may be gold, it may be silver, it may be anything. When even it is converted into ashes, they retain their power. And the same way, the Unani, Kustaj, Pasams, and everything was used on that basis. But still, that's more dangerous. Whereas the homeopathic system, the trituration system, the medicine making system in a homeopathic way is more advanced than the Unani system as well. You remember, I have not condemned the allopathic system. I have not condemned the Ayurvedic system. They have their own ground. They have their own stage to be used for the diseases. Materialistic. They are treating the material body, the material things they are treating. But I'm going beyond that level, that this material body is controlled by the vital force. And if we directly able to reach to the vital force, why to treat the liver separately? Why to treat the heart separately? Why to treat the individual organs? So I'm reaching at this point that if we go brought out the inner power of the substance which is useful to the human body, because there is a source to reach to the vital force is the body. Reach to the vital force, and in the same shape. What's the shape of the vital force? Invisible. But still retains its power, still retain its nature, still remain its functioning, how it controls the body. And ultimately, if you triturate it, it has been experimented thousands since 1790 when the homeopathic was recovered, and ultimately you can well imagine now we are passing through 2026. Many times verified things and many astonished things has happened when a doctor was treating any disease, physical disease, because people go for the physical disease mostly. Physical disease with homeopathic potentized medication. Potentized medicine, the substances which are converted or their inert power has been brought closer to the human body, human vital force, in the same shape, just like the ammonia gas and the ammonia salt. The physical substances are converted into the shape that they are equal level at the vital force. Vital force is invisible. But then how you can realize that? It has power. It has been experimented. It has been experimented. And if you experiment it, then you can understand it. That yes, it has power. And I have, in my life, I have experimented very important things, astonishing thing. You can say that a person is sitting just next to my table, and I'm taking his one hair, root hair, and I'm taking his history, and according to the base of the history, I find out that this medicine should be selected. This medicine seems to be suitable for this person, and I touch his hair root with that medications, and that person explained the symptoms of that medication. It's magic. It looks like magic, but it's not magic. It's not magic. It's the thing which experimentally could be proved. And this is what homeopathic is. And we should realize it, that when we control what was wrong in the vital force, that a person has a large liver. What has wrong in the vital force, that their kidney was not functioning, not filtering normally. If outwardly whatever has damaged, we have stopped that, because as a doctor, as a physicians, we know that what things can damage the kidney, what things can damage the liver, what things can damage the heart, we know that. And at this level, we have stopped all that. But we advise the patient not to take this thing because you are having liver problem, not to take this thing, you have heart problems, not to take this thing, you have a kidney problem. That we have already divided. Then vital force, how it feels, what was going wrong over there, it is expressed in the shape of symptoms. And those symptoms, not only the physical, these are mental symptoms. And if we take those mental symptoms and select the medicines on the basis of mental symptoms, because we have a materia medica pura, that we have thousands of medicines which has been proved that at what potency, at what level this medicine can affect the vital force, in what level, what type of symptoms it will affect the vital force. This has been experienced. It's a big thing. It's a samundar. It's ha. And ultimately, when we find out any exact medications which matches to the vital force feeling, magically it relieves the physical symptoms. So this is what I want to explain you, that believe in homeopathic system, go to a qualified doctor wherever you are, and if he is treating you basically with a proper way of homeopathic system of treatments, do not worry about that if there is a big tumor in your body. Do not worry about that if your liver has enlarged big and doctor says no, there is no recovery. In my life, I have told you many times, in my life, I do not claim that I can cure cancer, but I have cured cancer, rectum cancer, breast cancer, uterine cancer, prostate cancer, and brain tumor cancers. I have cured in my practice, and I have the physical proofs of all those things when they were coming from the other medical sciences hand, that no, now we cannot do anything. Radiation, chemotherapy, everything has been done. Even the surgery has been done, but even then, the tumors are growing, and under those conditions, those patients, they are still alive. What I'm talking about is not that I'm just talking in air. No, those patients are still alive. I treated them with homeopathic system of medicine. So I'm saying all these things so that you should believe it. You should believe it. You should try it, but not to try with the doctors who are not qualified, who do not know the principles of homeopathic, who do not know the depth of this homeopathic principles. Go to the qualified doctors, those who know about that one, and then when you will be treated in this way, ultimately you will get rid of the even the physical, the big type of diseases where you can imagine it. My time is over today. I was supposed to tell you about the aneurysm, but this question arises in front of me, and I was to explain that. Well, before I go to the systematic our homeopathic health education lecture series, we'll go to tomorrow on that one. And tomorrow this lecture will be in Punjabi, in Hindi. So it will be in Hindi. So join me at every day from 5 to 6 p.m. I will appreciate our cooperation of all of you so that this should be conveyed to the masses, so that the public masses should be learned. They should understand how this body is working, how this body is controlled, how a person becomes sick, and how a person could be cured. Rabaraka, God bless you all. And if ever you want to consult me in any way, to take a second opinion or want to be treated by a homeopathic system of treatments, you can call me at 408-687-1899. God bless you all. We'll see you tomorrow at 5 p.m. California Pacific time.